How can you recognize tuberculosis meningitis symptoms? Imagine a silent threat that can slowly invade your brain and spinal cord, causing serious health issues. Tuberculosis meningitis is a rare but severe form of tuberculosis caused by bacteria spreading from the lungs to the membranes covering the brain and spinal cord. Recognizing its symptoms early can make a big difference in treatment outcomes. In the initial stage, which can last from 1 to 3 weeks, symptoms are often vague and easy to overlook. You might notice a low-grade fever that comes and goes, feeling unusually tired or unwell, and persistent headaches that don't seem to go away. Some people experience personality changes, irritability, or aches and pains that seem out of place. Loss of appetite and general fatigue are common, making it easy to mistake these signs for other illnesses. As the infection progresses, more specific neurological symptoms start to appear. You could experience a severe headache that feels different from a regular headache, along with neck stiffness that makes it hard to bend your neck forward. Nausea and vomiting may occur, especially with the headache. Bright lights might become uncomfortable, leading to sensitivity known as photophobia. You might also notice confusion, drowsiness, or lethargy, which are signs that the infection is affecting the brain more directly. Some individuals develop cranial nerve problems, such as facial weakness or drooping, and in some cases, weakness or paralysis on one side of the body can develop. If the disease is not treated promptly, symptoms can worsen into a paralytic phase. This stage involves decreased consciousness, seizures, and even coma. Without intervention, the condition can become life-threatening within weeks. In infants and young children, additional signs include bulging soft spots on the head, poor feeding, irritability, and unusual postures like arching of the back and neck, which are signs of increased pressure inside the skull. Because the symptoms start off so subtly and can resemble other illnesses, early diagnosis can be challenging. It's important to be aware that symptoms related to brain function, such as confusion, personality changes, and neurological deficits, are key indicators of tuberculosis meningitis. People with weakened immune systems, like those with HIV or malnutrition, are at higher risk. Living in or traveling to regions with high tuberculosis rates also increases the chance of infection. If tuberculosis bacteria reach the meninges, they can form small abscesses called tubercles, which may burst and cause inflammation and increased pressure inside the skull. This can lead to nerve damage and brain tissue injury. Recognizing these symptoms early and seeking immediate medical attention is crucial. Diagnosis usually involves a combination of clinical evaluation, imaging tests, and laboratory analysis of cerebrospinal fluid. Treatment involves prolonged courses of antibiotics and supportive care to reduce brain pressure and manage symptoms. In summary, tuberculosis meningitis begins with general signs like fever and headache, then advances to neurological symptoms such as neck stiffness, confusion, and sensitivity to light. If untreated, it can progress to coma and death. Early detection and prompt treatment are essential to improve chances of recovery and prevent serious complications. Always consult healthcare professionals if you suspect any of these symptoms, especially if you are at higher risk or have been exposed to tuberculosis.